So first off today, we're going to start with Dr. Richard Henry. So I'd love to present him. So he's a postdoctoral fellow at McGill with the Scleroderma Patient Center Intervention Network. And he's also a fellow of the Canadian Task Force on Preventive Healthcare. So he holds a MA in Women's and Gender Studies from the University of South Florida, as well as a PhD in Health Psychology from the Virginia Commonwealth University. His research is focused on working with cohort-based trial models in scleroderma, sorry, I can never say that properly, and in transgender health. And he is also interested in examining the issues of health equity across different identities. So gender, LGBTQ+, ethnicity, disability, chronic health. And this work that he'll be talking about was funded by the SPOR seed grant that we had mentioned. So Dr. Henry, I'm gonna hand it over to you for about 20 minutes of presentation, and then we'll have 10 minutes for Q&A. Over to you.
Thank you so much for that introduction and for inviting me to speak about my SPOR Evidence Alliance grant project. It is an absolute pleasure to be with you all here with you all today. So my talk is entitled A Review of the Incorporation of Recommendation for Trans and Gender Diverse People in Clinical Practice Guidelines, Preliminary Findings, and Current Status. And it'll cover our pilot project that focused on Canadian CPGs, the progress on moving on to the reviewing international guidelines that I proposed in my SPOR grant project, and briefly touch upon some engagement with stakeholders. So some brief acknowledgements. I would like to acknowledge my co-authors and particularly my project mentors, Dr. Marshall and Toombs, along with our team of clinical advisors. As mentioned, this project was funded by the SPOR Evidence Alliance 2020 Seed Grant. I've also been funded by the MyTalks Postdoctoral Fellowship Award and Dr. Toombs a Tier 1 Research Chair, both outside of the scope of this project. And I am a training fellow, and Dr. Toombs was the past chair of the Canadian Task Force on Preventive Healthcare, which did produce one guideline included in the study. So objectives of this presentation, to give you kind of a broad sense of where I'll be going, to describe the incorporation of recommendations for trans and gender diverse individuals in Canadian clinical practice guidelines, to describe sort of our ongoing efforts and review process to move to an international study, and then the role of stakeholder engagement in this process. So a little bit of background for this study. I'm going to try and situate this in terms of the gender terminology we used for the project, context of gender health, and then why CPGs matter. So gender terminology, language is extremely powerful, and it's a critically component to providing appropriate and affirming care to individuals. It's also kind of constantly evolving. So for the purposes of our study, we use sex to mean anything assignment based on external genitalia, usually done at birth, or sometimes prior via an ultrasound, typically categorized as female, male, or intersex. Gender is a socially constructed characteristics of girls or women, boys or men, including all of the roles, the norms, the relationships or behaviors associated with each. Gender identity is one's internal sense of how one defines oneself as a woman, a man, both or neither. And gender expression, how the behaviors, body characteristics, clothing, voice, or other means used to signal one's gender identity. The terms you'll hear me use most will be trans or gender diverse, trans or transgender, being a person whose gender identity does not correspond to their sex assigned at birth. And it may be used to refer to an individual or as an umbrella term for any individual whose gender does not conform to traditional gender norms. Gender diverse is more typically used as an umbrella term to describe people when their gender identity or expression does not conform to the male, female, or man, woman binary. So trans and gender diverse health. There are many well-documented health disparities for trans and gender diverse individuals, both in terms of physical and mental health. Trans and gender diverse individuals interact with the healthcare system in many, many different ways, both in terms of traditional health, so all of our primary healthcare needs, all of specialty care, but also in terms of specific transitional related healthcare. There's also a high level of unmet needs for trans and gender diverse individuals. In a survey of 2,873 trans and gender diverse Canadians, 81% reported that they had a primary healthcare provider, but 45% still had at least one unmet healthcare need. Added to this, clinicians often lack necessary training or confidence to provide gender affirming care. So even when trans and gender diverse individuals are in contact with the medical system, they may not be able to access the healthcare that they need. So what are clinical practice guidelines? So these are tools that are specifically developed to support clinical decision-making. This can include who should be screened for certain conditions and what sort of assessments need to be done in particular cases. Why is it so important that clinical practice guidelines specifically address trans and gender diverse individuals? Well, many clinical practice guidelines are sex binary. So understanding how an individual's risks factors may increase or decrease or stay the same due to their gender identity may be relevant to how a guideline gets implemented. Furthermore, they may be very important considerations for medical transition. So for example, if a trans woman has vaginoplasty, gender affirming bottom surgery, there will be implications for things like prostate exams. And also, while some clinical practice guidelines do exist for trans and gender diverse individuals, they tend to focus exclusively on medical transition related care and do not generally include general healthcare recommendations, or at least not those based on rigorous evidence review. What needs to be done to address trans and gender diverse individuals in clinical practice guidelines? Well, we need to include them in traditionally sex binary clinical practice guidelines, such as those about breast cancer screening. Breast cancer screening typically addresses women, even though men can also get breast cancer. However, there are very important implications for both trans men and trans women, especially depending on their medical transition status. We also need to consider clinical practice guidelines that are traditionally implemented differently by binary sex. For example, fragility fracture risk scores are weighted by sex. However, it's unclear if medical transition status may impact which sex scoring to use for trans and gender diverse individuals. And then also guidance that is different based on binary sex. For example, in aortic aneurysm screening, it is recommended only for men. So how might this recommendation be applied to trans men and trans women? There is also issues of evidence for clinical practice guidelines. Clinical practice guidelines are created through evidence reviews. So what do guideline producers do in the absence of evidence for trans and gender diverse individuals? So this is a very real issue, as to date there is very limited research, including individuals beyond the sex gender binary. Best recommendations currently are to identify groups relevant to a guideline a priority, to seek evidence in the review, and if it's not available, to document the absence of evidence. It's also important that when considering implementation of a guideline, that considerations for population relevant to a guideline should be noted where possible. For example, breast cancer screening for trans men and trans women. So the objectives of our study was to evaluate the proportion of CPGs that mention trans and gender diverse individuals. So we're just looking for, were they mentioned? Did a guideline at least engage with gender diversity in really any fashion? To assess whether it addressed implementation issues or applicability for trans and gender diverse individuals. To determine if trans and gender diverse people were involved or consulted as part of the creation of that clinical practice guideline, and then to identify examples of inclusion. So this was a descriptive study that really reviewed recent Canadian general clinical practice guidelines relevant to trans and gender diverse individuals. We started by doing an environmental scan with gray literature to try and identify conditions relevant to trans and gender diverse individuals, followed by expert feedback. We used that to identify 10 conditions to include in this review. We then used the Canadian Medical Association infobase to search for guidelines using this inclusion-exclusion criteria that they needed to be related to the conditions and interventions that we had identified, published in 2015 or later to be clinically relevant, developed by an organizational or ad hoc producer. Ad hoc producers being defined as groups formed with the intention of creating a clinical practice guideline and funded or sponsored to do so by a recognized group such as Canadian Institute of Health Research or the Public Health Agency of Canada, needing to meet one of the three criteria. So based on assigned sex, involved binary sex risk assessment, or making different recommendations based on binary sex. We excluded any clinical practice guidelines that were based exclusively for the care of trans and gender diverse individuals, dealt for the care during COVID-19. We did 2 levels of review for inclusion, title abstract, full review, piloted our data extraction with 5 clinical practice guidelines, and extracted publication characteristics along with our study objectives. To determine how many clinical practice guidelines we needed to include, we calculated the number of clinical practice guidelines that would needed to estimate proportions for each study objectives with a 95% confidence interval and a width less than or equal to 20%. We assumed that the proportions that would meet each study objective, i.e. that would make a specific recommendation, would vary between 0 and 20%. So if 10% made a recommendation, we would need 34. If 20%, we would need 60. So we determined that we would probably need to include 60 clinical practice guidelines. For our results, we report proportions with 95% confidence intervals of all of those that mentioned trans and gender diverse individuals recommended, made specific recommendations, addressed implementation, or included trans and gender diverse implementation. Or excuse me, included trans and gender diverse individuals in the development. We also describe examples of gender inclusive clinical practice guideline elements. So we identified 282 clinical practice guidelines in the Infobase database, 116 excluded at the title abstract level, 125 full text, leaving only 41 eligible clinical practice guidelines, majority of which were government sponsored, created by government sponsored groups and published in 2018. we found that the vast majority of these clinical practice guidelines did not mention trans and gender diverse individuals at all. 5 clinical practice guidelines mentioned trans and gender diverse individuals only. 1 mentioned and provided recommendations, and 1 mentioned, provided recommendations, and implementation, addressed implementation. Interesting to note, 3 of them were from the HIV condition, and 2 were cervical cancer. So there did seem to be a little bit of a condition bias, or of certain conditions did seem to represent more in those with mentioning. Although it was a small enough sample, there really wasn't any way to draw conclusions from this. So 41 out of 41 clinical practice guidelines, only 7 mentioned, only 2 made any recommendations, and only 1 addressed implementation. None reported consulting or involving trans or gender diverse individuals, although we did not contact any of the guideline producers, so we cannot say with any certainty that nobody on the team was not. Only 1 clinical practice guideline met 3 of the criteria. It was related to the use of PrEP in HIV. Overall, there's really limited guidance in any Canadian clinical practice guidelines. And if you pair that with the minimal or any training, this can present a really major barrier to providing appropriate gender affirming care for trans and gender diverse individuals. So what can be done? Well, there is some existing guidance on equity in guidelines. This includes the GRADE equity guidelines, which prompts consideration of health equity during clinical practice guideline development, including things like location, race, occupation, religion, sex, gender, education, and socioeconomic status. The National Academy of Medicine recommends that all relevant parties should be included in the clinical practice guideline development. Progress Plus from the Campbell and Cochrane Equity Methods Group has guidance on identifying populations and relevant health outcomes to improve equity, and emphasizes the need for clinical practice guideline producers to identify relevant target groups at the outset of clinical practice guideline creation and incorporate feedback from these stakeholders throughout the process. And then finally, the GRADE Equity Series provides guidance on considering equity when setting priorities and questions for evidence review, and including the search for evidence, which may need to include searching outside of traditional health literature, such as gray literature. What can medical professionals do while waiting for more inclusive guidelines? While reaching out to community organizations, contacting professional organizations, consulting clinicians with expertise, and then seeking continuing education and training opportunities. Some strengths of this study is it addresses a previously unstudied topic using a systematic approach. This being a pilot study, it was limited to Canadian clinical practice guidelines and may not generalize. It was limited to the CMA infobase, so other eligible clinical practice guidelines may not have been cataloged here. Only 41 eligible clinical practice guidelines were identified, less than our target number, although it was clearly a sufficiently robust sample to highlight the gaps. And we had limited community engagement at this stage, although 2 members of our research team do identify as trans and gender diverse. So I know I'm running low on time at this point, but I do want to quickly address our current status and stakeholder engagement. So when we first began this project, we really kind of spent a long time thinking about who our stakeholder groups needed to be. And we identified really 3 groups. We have the trans and gender diverse individuals, who are really at the end, the beneficiaries of the clinical practice guidelines. We have the clinicians who rely on the clinical practice guidelines, and we also have the guideline producers. So we have started working with our clinician group, which includes a range of specialties who are most often engaging with trans and gender diverse patients, as well as produce guidelines. And we are in the process of recruiting our trans and gender diverse advisory board. And then our current status is that we have a protocol and search strategy almost finished for our international guideline. And we anticipate being able to complete the search for clinical practice guidelines internationally by the end of the month and beginning review of them by January next year. All right. Thank you very much.
Great. Thank you so much, Dr. Henry, for that incredibly informative presentation and very interesting and on such a very important topic. So I see you have a really nice comment from Sabrina Chaudhary, just saying, you know, this is just such important work and wonderful plan for your stakeholder engagement as well. And so maybe I do have a couple questions, but I would love to give the opportunity to everyone here. Does anyone have any questions for Dr. Henry? You know, I thought it was quite interesting that, you know, very few of the 41 guidelines did not mention trans or gender diversity. So it just shows, you know, the really important work that needs to be done, I think, in this area. And great to see that you highlighted the grade equity guidelines. I think those are really important. And I think I like how you talked about it from the review. So at the knowledge synthesis stage, as well as the guideline stage, I think is very important. So maybe what we'll do is while we're waiting for one or two questions, I will ask you a question. So one question that I had was, how would you describe the role that you feel that the Trans and Gender Diverse Advisory Board would play?
Yeah, so one of our hopes for the trans and gender diverse individuals is we were hoping to get a lot more examples of inclusion in these guidelines. And we really wanted to sort of get their feedback about what good inclusion would look like. And unfortunately, we really don't have a whole lot of that to work with, obviously, with only 7 mentioning and very limited implementation guidelines. But what we do have, even in just the mentioning of trans and gender diverse individuals in those few guidelines, is the way that they're being mentioned is sometimes maybe not the most appropriate. And that is something we'd love to have an advisory of trans and gender diverse individuals address, to be able to make recommendations for ways that maybe this could be done better. One of the guidelines, for example, said that trans and gender diverse individuals were just simply beyond the scope of the guideline. And so being able to maybe speak back to that a little bit and address, you know, ways that they could be included, even if it's felt beyond the scope for a guideline producer. Another guideline said that they recognized it was addressing pregnancy and diabetes and pregnancy, and it said that they recognized that trans men can be pregnant, but for the simplicity of language, they were only going to use women. And so they acknowledged that this was an issue for trans individuals as well, but they were going to misgender or simply ignore this group in the language that they were using. And so ways that they might kind of, how would this be easily addressed that would feel inclusive to everyone? These are some of the things that we'd love to ask, you know, a group of trans and gender diverse individuals. So some of those very real issues that we're seeing in guidelines that are actually out there right now.
Oh, great. Thank you. Thank you so much. And I think you bring up some really important points. We do have a question in the chat box. I think we have time for this. Megan, did you, well, actually, first I'll ask Lisa if you wanted to unmute yourself and say your question, or if you wanted us to read your question for you.
I can ask.
Oh, perfect. Thank you.
I liked your examples because I hadn't really thought of it. Things like osteoporosis and other non-gender health issues that are important to, because there's kind of a gender or a sex association with them. So that was kind of interesting. But I wonder, I'm a researcher as well as a clinician, and I look at all the research, and you're looking for statistical significance in your outcomes as well as clinical significance, and then you use that research to inform your clinical practice guidelines. But a lot of that research, when we look for gender diversity, it's actually, in my area anyway, it's fairly rare to find somebody who's gender diverse. So then you have 50 people who identify as men, 49 women, and one gender diverse person. You can't make any conclusions with that. So I would see how it's hard to inform clinical practice guidelines based on the background research. Do you have any thoughts or suggestions on that?
Yeah, and that is definitely one of the issues that we run into is sample size, and where do we get these numbers, and the lack of evidence is that one of those issues that I kind of brought up in my background. And I think sometimes, when we're talking about an issue having a sex component, we can maybe do a better job of acknowledging what it is about sex that's driving those implications. So when we're talking about sex, is it like fragility factors? It's very often, a hormone issue. So are we talking about hormones in this case? And if so, that's something that we can at least address, even if we haven't studied it directly. We can say, this is something we may need to look at, even if we don't have evidence. And we can note that there's a lack of evidence, but this is an important thing to consider when working with a client who's gender diverse. So we can note lack of evidence, but we can also note some potential implications there.
Being thoughtful about how what you do know influences what you would recommend for different populations.
Yeah.
Thanks.
Yep.
Great, thank you so much.